Hi guys, Dr. Nick here. Today we're going to continue our series on LDI, low dose immunotherapy, and today it's going to be all about communication. So what do I mean by that? So I think the most important part of LDI therapy is the communication between the patient and the doctor. A lot of times we forget about that fact, but that's the most important thing because the whole premise of this therapy depends on the objective, or I would say more subjective, nature of the patient in terms of their symptoms. So if the patient doesn't communicate properly back in terms of if symptoms got worse, better, or no change, then it becomes a little bit more difficult in order to be able to see if we're going to keep titrating the same dose or if we found the right dose for the individual. So the major thing with this in terms of avoiding any flaring is proper communication, and that's what I've always seen in my practice. So that's why even in my practice, what I have for patients that I send them home with is something called LDI Dose Response Symptom Tracker. So as you can see here, so just like we said before, I have patients write down all their symptoms that we've had from baseline in terms of the most prominent ones, and then we write if they were better or worse or neutral after the given dose, and if it was better or worse, by how much. So would that be like 10% better than baseline, 50% better, or even 30% worse from baseline? But it doesn't end there. What we need even more importantly is for how long do those symptoms last. So say if you got worse by 30% and it lasted 3 days versus 7 days, that's very different. Why? Because the next time we come back to this dose, we have to give you a weaker one, but we have to know the intensity of the flare or the worsening of symptoms in order to be able to give the right dose next time. So we have a better understanding of where to start in terms of a weaker dose. Same thing with the stronger dose. So if we know that if we're giving a specific dose, you got 55% better. Only half the symptoms are better from baseline. That gives us information because for the next 7 weeks, we can't give you that dose again. We have to wait at least that 7-week period before we redose you. However, what might happen is that if that only lasted for 7 days, within that time frame, we might be able to give you a booster dose, which is much more weaker. However, when we get back to that 7-week period, if we think there's a possibility that you do need possibly a little bit of a stronger dose, then what we'll do, we're going to physically maybe titrate the dose a little bit down, or we might give you an extra unit which would increase the dose strength by say 25%. So that's why communicating properly in terms of the symptoms is very important overall, so that me as a doctor, I can understand better and communicate back to you better in terms of what dose to take next, or where to stop when we're titrating, and what to look for the future dosing. So that's why proper communication is very important in order for us to communicate on the same level, so we know what steps we have to take next in terms of your specific LDI dose, or if we can move on to a next LDI dose. Because the whole point is that if we know that based on our tracking sheet, you have maybe only 4 out of the 8 symptoms that have gotten a betterment from this dose, then we know that there's something possibly else that we have to work towards in terms of LDIs to help with the other symptoms. And that's the most important factor as we're waiting for that 7-week period to redose somebody on that original LDI that worked or made somebody worse. We can do more within that time period where we can add another LDI in there to see if the other symptoms will be ameliorated. And that's why it's so important also, as we said previously, so we won't flare. So if we can communicate properly and we're articulating well enough on both sides, then we have more of a possibility of achieving the goal of ameliorating your symptoms with the LDIs, and at the same time avoiding flares. Because that's the most important thing for me, and I do that with all my patients, and I always think about every patient in terms of trying to minimize any possibility of flares for that reason. So I hope this video helps you understand a little bit more in terms of how to properly communicate with your LDI provider, and the way that I kind of do it might be a little bit different than others. But overall, I hope it was informative, and continue to follow me so you can watch new LDI videos in the future.